Good afternoon, Curro family. I am Dr. Schalk from Dr. Luke on Call, and it's a great privilege for me to be able to speak to you today, the 16th of March, on our current situation in South Africa with the COVID-19 coronavirus. As you know, our president spoke last night, and all schools will be closing on the 18th of March, on Wednesday. So the reason for this video is to discuss a few things. We need to speak about the current situation in the world and South Africa. What do the numbers look like? A quick little information on clinical symptoms, and then three main points. Number one, why do we actually have to close the schools? Is it fear? Is it panic? Are they overreacting? That's number one. Second thing we need to discuss is symptoms and progression of symptoms. If anyone gets infected by the virus, what to expect. And the third thing to discuss is to test or not to test. What are we supposed to do? Do we all suddenly go somewhere and test for the virus? Okay, so let's start. I think important thing, let's see where we stand at the moment in the world, and the statistics we are looking at now is the current ones. I just downloaded them and looked at the levels where we are. It's Monday afternoon, 3:45. So cases in the world, 174,134. Now remember, these numbers are actual tested cases, confirmed cases. We obviously cannot test all the people that get infected. So the actual numbers, the real numbers across the world, probably a lot higher than this. But we got to work with numbers that are real and that we can, evaluate what the ratios are of people getting better, people getting worse, and people even passing away. So deaths 6,684. Recovered patients, very important, 77,865. Completely recovered. And remember, now you have immunity against the virus, you can't get it again. Countries involved at the moment, 160. And South African numbers at the moment, 64. And again, probably by the time that you watch this video, these numbers would have definitely changed quite significantly. Quickly recap the clinical features. Fever, 98% of people get a high fever, above 38 degrees. The reason why, it's the first time we have this mutation of this virus. Remember, coronavirus has been known to us for many, many years, 50 years almost. It's an animal virus. We had the first human mutation in the SARS virus in 2003. We had the second one in the MERS virus in 2012. And now we've got the COVID-19 disease caused by the coronavirus. So 98% get a fever because you've got to make new antibodies. No one's got antibodies against this specific virus, and that's why the temperatures really spiked quite a bit after a few days of having the virus. A cough develops in 76% of patients, and remember, it's a dry cough. It's not your normal bronchitis, phlegmy cough. Then also dyspnea, which means shortness of breath, difficulty in breathing, especially in our older patients or immune compromised patients. That's where we get those symptoms. Myalgia, sore throat. Myalgia means body aches and pains. Sore throat, not predominant symptoms like you would get with the influenza flu virus. It's not the main thing you'll get. You can definitely get that the first few days, feel a little under the weather, a little bit weak, a little bit fatigued and tired with a bit of a scratchy throat. And we'll talk about that just now. Okay, moving on. Why close schools? The very important thing to remember is that we've got to flatten the virus curve. Now, what does that mean? It means if you don't do anything, then there will be a slow start and then there will be a rapid progression with lots of people getting sick, like we saw in Italy and like we're seeing in some countries that didn't take early precaution measures and that still allow flights coming in, that still have their schools open. They've got this incredible increase in numbers, and the healthcare system cannot cope with that. So what you try and do, you try and limit the progression and the fast spread of the virus. So you want it to happen over a much longer time, 2 to 3 months, and a slower spread. So it's important. The reason why the schools were closed, and I think it was a real good a decision that was made by our government is to stop the rapid spread. Because remember, the younger people are going to be fine. They get illness, but they recover very quickly. They don't even know why, but their immune system seems to be responding much better than the older people. In Italy, the statistics out of the first more or less 800 people that actually passed away, there were only one person between 30 and 40, nothing under the age of 30, only one between 40 and 50, and then from 50 to 60, 60 to 70, and especially above the age of 70, the numbers really started increasing. So we have to look after our older people, and we cannot get the virus rapidly spreading amongst schools, universities, or other gatherings, and then those people get in contact with immune compromised people, TB patients, or our older patients. So it's really for the system to cope and for the country economically to survive. So that's important. I think it was a really good move to do that, and we obviously got to put things in place on how to do learning and e-learning, but the schools will do that, and I'm sure Curro would be a leader in the field to do that. Then secondly, symptoms and progression. So I've divided it up in 3 categories. It's still not 100% clear, but we've got a very good idea now that we've had almost 2 months of the disease across the world and this pandemic has been spreading. So we know in the first 3 days you can infect other people. So what happens? You inhale the virus, because remember, it's a droplet spread virus. It doesn't float through the whole room. But if someone coughs or sneezes close to you within 1 to 2 meters, those little droplets, you inhale them, they land in the nose and in the back of the throat. And there the virus has to start accumulating. So it needs your cells to make more of itself. Remember, the virus can't make its own. It's not a bacteria, it's a virus. It only has a little bit of genetic code. It's got to infiltrate your cell, and your cell's got to make another virus. So it does that in the nose and the throat. That's why when they test, they do a nasal swab. They take a little cotton swab and they swirl it in your nose, and they take that and test that, because there will be viral specimen on the sample swab that they took. So that's where the virus will start in the first 3 days. You're not going to have a lot of symptoms, maybe slight sore throat, slight scratchy nose, but not your normal cold and flu symptoms. But fairly mild symptoms in the beginning, maybe a bit of fatigue. And that's the key, is that you actually need to be home when you don't feel that sick yet. That's why we're asking people to actually stay home and closing schools. Because that time is when you can definitely infect people. Because you don't feel that sick and you don't actually want to stay at home. So that's also why we recommend drinking hot water, drinking lemon water on a regular basis. When you come back from maybe the shops or wherever you were, take a little bit of hot water or even tea, so that you can rinse the throat at the back and get that hot water through the back of the throat. The virus does not like high temperatures. Above 25 degrees, it doesn't survive long on surfaces. Above 50 degrees, the proteins around the virus will denaturate, and you'll actually destroy the virus with the heat. Once it's in the lung, you're not going to be able to do much with that. Then it's reliant on your immune system. So then the second phase, you almost feel a bit better in some patients, and then the second phase from 4 to 6 is when a virus actually goes to the lung, and that's where it wants to be. The little proteins around the virus that they call the crown, those little dots, you've probably seen some pictures of it. I'll put one on so you can see while I talk. Those proteins wants to go to the lung, so they bind to the lung tissue much better, much easier. So they accumulate in the lung, and then from round about day 4, 5, 6, you actually suddenly start feeling lung symptoms. What's that? It's a dry cough, and then the temperature spikes. So your high temperature develops a little bit later, and it's really a sudden onset. People feel, I'm really feeling feverish now, and I'm getting this dry cough. The majority of the patients, 90%, will not be short of breath and will not struggle to breathe. Around about 10% of people will need admission, and it's predominantly the older patients will need admission. The other patient, please, we need our people to look after themselves and stay home. We cannot just run to the ER because you've got a fever of 38 and want to be tested, because those people need to stay there for the next month or 2 months. They can't get sick, because then we can't look after the patients. So that's really crucial. Do not go to a hospital when you get a fever. Do not go to the emergency units, to the ERs. It's really, really crucial. Even if you want to go to your doctor or your clinic nurse or a clinic, let them know that you might be infected so that they can take the necessary precautions. That is really important. Okay, to test or not to test. This is a big question. Everyone's asking this now. Should we test? Should we not test? If you get a positive test, let's say you do go test, you've got a mild fever, you do go test and it's positive, what are you going to do? You're going to go home, you're going to take your fluids, you're going to take your vitamins, you're going to rest, sleep enough, make sure you don't infect other people, wait for your antibodies to build up, which is around 5 to 7 days, and you'll be over the bulk of the illness, and you need to wait 14 days because you might still be infective to other people up to 14 days. Yes, when you've got high risk, immune compromised patients, patients undergoing chemotherapy maybe, patients with a TB history, very bad lung history, those patients, yes, they need to be tested because they very well might need admission. Testing facilities around the country, the private labs like Lancet or PathCare or Ampath, they all offer testing, but only at certain depots. You can't just walk into a laboratory and say, you need to test me, because those people might not be prepared and you can infect them. So please phone ahead, ask them. I know for a fact that one of them actually have a drive-through service in the Cape Town area, where you let them know you need a form completed by a doctor. It's the national form that is required. You cannot go there without that. They will take the form from you and they will do a nasal swab and or a throat swab and send it away. It's almost like a drive-through, and then you can be off, and the results will be available normally in about 48 hours. So I think the message of the day is be wise, stay calm, be informed. We will survive this. Our children will survive this. So please do the right thing, protect yourself, and absolutely limit the spread of the virus as much as possible. Thank you for watching, and remember, stay healthy.